Hi guys, and welcome back to Milk Mummies, the podcast where we keep it real about motherhood, identity, and everything in between. Today, I'm joined by Kirstie Simpson, Chief Operating Officer of the Mummy MOT, and highly specialist physiotherapist with over 15 years experience. We're diving deep into what postnatal care should look like, why pelvic health is so overlooked, and how the Mummy MOT is helping women across the UK recover, rebuild, and feel seen in their motherhood journey. Whether you're a new mum wondering why no one told you about prolapse or a practitioner passionate about better care, this is the episode for you. Let's get into it. Hi, Kirstie. How are you?
I'm good. Thank you. It's really good to be here. So thank you.
Amazing. I wanted to, just jump into it and start with your own journey. What led you into physiotherapy and more specifically into pelvic health?
Sure. So it goes right back to being a child, really.
Okay.
So I used to watch Birmingham Children's Hospital on TV with my dad.
Yeah.
Really invested, loved the paediatric side of that and just watching the rehab side and the progressive impact that physios had on not only just the child, but the family life and then obviously ambitiously that child's future.
Yeah, okay.
So I always held that in sort of high regard. And then I just, became a bit obsessive, I suppose, about looking into physio and following the journey very early into getting early through the doors of university and checking it out and where I wanted to go.
Yeah.
Getting to know people. Sometimes it's those connections that you build are really,
This is true.
really helpful on your journey, really. So I was lucky to get a place. I studied, and although I did, when you come out of physio, you do your core rotations and things. So musculoskeletal, neurology, cardiology, and then just again came back to that organic. Why am I here? Why am I here? And it was again that paediatric side. So I was very lucky. I had a career where I spent a number of years following that. I became sort of a clinical lead over children's services here in the UK.
Yeah.
And then I was seeing mums. Mums come in with these children, don't they? So I was seeing anything from a sort of a prem baby all the way up to 19.
Wow.
And some children would have complex needs. So I would see anything from a new mum coming in with her first child to a mum coming in having had a third or fourth. And you just get natural conversation flowing with them as you get to know them. And with that, you kind of learn and this was prior to being a mum myself, actually. So you see that then mums carry their own birth stories, they carry their own pregnancy journeys. And often when you've got children, let's face it, the world becomes about them.
Yes, it does.
We become very invested very quickly. We become very selfless. And I think often with that, it comes a risk of neglecting our own needs or pushing them to the back or pushing them down. So it was then when I kind of had that, I suppose, in my radar about this experience. And I was seeing friends getting pregnant, some easier than others, journeys to pregnancy, some people having fertility challenges. And then other people, having a very, what you would perceive as a normal birth, or what we would call as a typical birth, I guess. Where recovery seems quite straightforward. And then other people who didn't have quite so glamorous stories. But either way, there was always something that I'd hear having a coffee or sitting over a play date or, catching up with a friend over a glass of wine of an evening when they've got the moment without the child. And you just start to learn that women were carrying challenges, be that they were having sort of pain, pelvic pain, or their sex life had kind of taken a twist because suddenly they were experiencing pain or aversions because they got body confidence issues, or that they were starting to have leaking. And sort of urinary or, kind of friends saying, I kind of didn't quite make the toilet. I pooped. I pooped in my pants. I'm changing my baby's nappy, but here I am, rushing to the toilet, carrying a bag of shopping, carrying my child, trying to contain a 2-year-old at the same time and didn't quite make it. And then when you start as a physio, your brain kind of wires into all those kind of, not that you want to treat your friends all the time, but they're either asking for your advice or you're navigating it.
Exactly.
So you'd start to just ask those intriguing questions, kind of, not quite blurring the friendship and the clinician barrier, but certainly get a bit more intimate in your level of conversation. And it was just kind of, I'd hear things all the time, even again before carrying my own children of, oh, it's okay, it's, I've had a baby. I've had a baby, this is normal. Or, oh, yeah, so-and-so, another baby group said that this happens to them too. So, I just know that it happens. And you say, spoke to the doctor, seen the midwife, when they've come out in that couple of weeks after having baby at home. health visitor even maybe might have had a conversation with you. And I so many times was hearing, oh, no, they don't ask me. Or I can't tell them about that. They're here to talk about, whatever their child's called. And again, time and time, the neglect coming in. And I was thinking, there's got to be something. And again, that's kind of pushed down in my own story, really. I'm hearing it, but kind of would give whatever advice I felt I could give with my generic sort of more physio side. But then I guess it was a bit of an itch that was there to be scratched at a later date.
Okay.
And then I had my own baby. I had Jacob, and with Jacob, I basically had what you'll hear of as a perineal injury, so perineal tear. Tear down south, however you want to refer to it. Destroyed. You hear all these. Inflammatory words. I've been ripped to shreds. All these stuff that we attach so much, but with that, we take the laughs away, and there's an injury or there's an emotion behind that, and symptoms that follow with stuff like that. So I think I spent my maternity journey, enjoying maternity life with Jacob and my eldest daughter at the time, Molly. Of course, doing all the things that a new mum does, baby groups, catching up with friends, running to the school trip, and navigating logistics of 2 children. But at the same point, I was carrying the fact that, I was leaking. I got this sort of stress incontinence. Okay. I was popping off, farting, whatever you want to call it. Yeah. Flatulence, if we want to be really eloquent and techie. But yeah, I was kind of doing this thing. I was thinking, God, this is feeling less cool now, Kirstie. Like you've got these symptoms that you've kind of heard about, but and I guess it just drove that journey to type into Google, about the symptoms and I'd had my own, following that tear, I'd seen the midwife had come out to my house. I'd been stitched up. The midwife didn't want to see my stitches. There was no, I was ready to reveal all. At the time they arrived, I was double pumping on the bed, looking very, new motherhood.
Just,
really striking. And then they came up the stairs and I was all ready to kind of lay everything out. I was still within that sort of... This is me
now.
24 hours after, you're still happy to kind of get naked.
This is true. It's just like, people. Once it's happened, you're like, I don't even care anymore. This is just what it is. Yeah.
That's it. So with that, and I was fully expecting it. And then the question never came. The question never came. How's your stitches? Are you sore? Like below? Are you having any challenges? What's your sensation like? And therefore, I as a healthcare professional suddenly felt a bit lost, a bit abandoned when they'd left. But myself recognised I wasn't speaking up about it. I wasn't asking the
that's
questions.
true. Yeah.
Where in a world I would be more naturally, typically aligned to do so. And then again, doctor's 6-week check came and went. It was very focused on Jacob, which obviously as a new mum, you're invested into the questions being about them. Of course. But again, no dialogue came about the fact I'd had a tear, I'd had stitches, had I got any overriding symptoms. And I kind of again left, and it just kind of sat heavy, and again, I found myself closing off from the conversations at baby groups and catching up with friends, because suddenly I felt that awareness of, words maybe shame are too strong, but, is this going to get better? And then at some point I thought, right, I need to change my Google search. I need to search how we solve this. How we change the dialogue.
Love it.
And the Mummy MOT popped up. So the Mummy MOT, founded CEO Maria Elliott, a fabulous lady. She, again, from her own birth journey, an experience in this country and in France, kind of saw the parallel differences, I suppose. And with that, then strove from being a hand therapist, she went on her own journey around pelvic health. Brought it back to the UK and became a pelvic health therapist, worked at Chelsea and Westminster, sought her own training, and then thought, hell, why is no one talking about this? Why is it not open dialogue? Why are we not training people to do this as course? So that's what she did. She set up training in her living room. So suddenly I was finding myself on this website that has an area which is very much mum focused. So I could look up, I could seek some education, some guidance, some advice. But at the same time, they got for the professional area. It's kind of this training side cropped up. So I found myself suddenly booking my place, the Mummy MOT practitioner course, 2-day training in London to go and learn about what a postnatal check can look like, what I could have had, what I could now offer to other people. So again, that kind of took my journey in because my eyes were opened on the training.
Of course, yeah.
This was like normal dialogue. It wasn't a hidden, it wasn't a taboo, it wasn't a conversation to quieten or say it was normal. It now had an approach to assess and an approach to help seek empowerment and solving these issues for women.
Yeah.
And then, for me, I kind of became the practitioner. And then because of my background in NHS in sort of quality improvement areas, again, seeking to strive and improve and change and transform, I then took on the role really around sort of helping support some of the tutoring on the programme. And then over this last couple of years, kind of grown into working side by side with Maria Elliott now to really empower the movement of the Mummy MOT.
Yeah, that's brilliant. I mean, this all started from watching a TV show with your dad, as you said. Yeah. And then it just... So I just love how little things like that just really impact someone or just resonates with you, and you followed it from strength to strength to strength. You studied, you trained, and now this is where you are right now. Yeah,
and I still have my interest with all the children, so I've had all my experience, but now to be able to see both sides, one's not neglected or pushing themselves down, or just to even have that open conversation.
That's brilliant.
We should all be doing it.
No, I mean, you said it. You said a lot of things that just struck a nerve with me, because I remember friends who want to have kids but they haven't had kids, and their biggest thing is, oh my gosh, I don't want to tear. I'm gonna get ripped. Like one of my friends, love her to death, but hers, I'm gonna get ripped. I'm gonna get ripped. Into half. And it's like, well, no. When I was pregnant, that was definitely something she was saying. I'm like, bro, listen, I've got to push this baby out. I don't need to be hearing that. But it is amazing how we know the things to be fearful of, or people can talk about the negative things, but no one ever really couples that with if it does happen, this is how you can be fixed, or how you repair, or how to look after yourself. Like when I came across the Mummy MOT, it was actually on this podcast, and a friend of mine just mentioned she had a little one a few weeks after, or whenever she decided to do, she went to have a Mummy MOT and blah, blah, blah. Just super comfortable and easy conversation. I was like, wait, what? What is a Mummy MOT? I've never heard of this before. And then I started doing my own research, and I was like, oh my God, how have I never heard about this at all? So it was amazing understanding and discovering that there are resources like this out there and what it is that they do. So I was just super keen to have you guys down just to share and to talk about it. And the fact that you talked about the tear, what did you call it? You called it a perineal injury.
Perineal.
I've never heard anyone express it that way. It's like it's either a tear or a rip or whatever. So it's just nice to kind of have the right dialogue being introduced into the space when it comes to things like this, because it happens all the time. Like with my pregnancy, I had a graze. It was in my head, oh my gosh, I'm going to tear. But at the same time, you're in it now, baby's coming. So that's all that matters. But then also just trying to attract or be positive about the things that I want in my space, and dealing with whatever happens as it does, not trying to preempt anything. But even having the graze, I was informed it wasn't terrible. It will heal as it is. But I mean, with hindsight, I don't know if I should have had any more instruction on how to take care of that. But it was so matter of fact that I was like, okay, well, my body will do what it's supposed to do and kind of keep it moving there. So,
I think as women, like we go through such a massive, such a fundamental change, and then a change like no other really that we see of the human body in terms of so transformative and over such a period of time. And of course, there's so much literature, so much education and advice and books and everything aimed at the pregnant woman.
Yeah.
But it's very much focused about in that pregnancy. But we don't, we see now actually, if you Google into the fact I'm on this podcast, for example, even is one thing. But even if you look on your Insta and your socials now, there's so much open dialogue around pelvic health and women's health. But there's still not sort of a transparent approach to these conversations about how you prepare and optimize your body for birth. As part of those antenatal classes, there's a lot spoken around about the birth itself, or breath work with having a delivery or the types of delivery. Yeah. But there's often still aspects of education missing that we could be putting in. And certainly in those early days, because a Mummy MOT, we would typically see a mum from 6 weeks.
Okay.
But we could be starting work with a pregnant woman.
I see.
And having those advice and guidances.
Yeah.
But equally so, people think that the Mummy MOT is just explicit if I've just had a baby, whereas actually it's not time bound. You know, we see people all the time who hear about us and they're maybe 4 years down the line, 7 years down the line, or they've just stopped having all their children, and now they're hearing about it because the movement's catching on a little bit. And yeah, if you've got symptoms, then we can
come on down.
Come on down. Yeah.
You've been working in this space for over 15 years, if I'm correct.
Yeah, so I've been qualified for about 16 years. I've kind of moved into this space in terms of more pure pelvic health in the last few years, but obviously. It's just, I think when you have your own experience as well, it's that sort of you become a bit more deeply attuned. Yeah. Because, and I'm not saying, a number of our practitioners, of course, have had their own birth experiences that surprisingly leads them into their own journey with this. Yeah. But don't have to be. It can be their observations of other people around them that have struck a chord. Okay. But I think for me, it's made me really deeply attuned because I can resonate with that emotive journey, the physical journey. Yeah. To bridge the world of clinical and personal emotional experience together, really.
What would you say has changed the most in how we approach women's postnatal care in the time that you've been working in this space?
A good question. I think it's probably becoming more open. I think we've seen over the last number of years, we've seen menopause be a bit more of a buzz kind of word in women's health space. And I think the fact that we are starting to break some of that, becoming a bit more of a coffee shop conversation between women. Okay. And also I think that we're seeing a bit more of a multidisciplinary approach. I think whenever we've thought around pregnancy or postnatal care, we went back a few years, you would typically hear, oh, it's my GP, it's my midwife, it's my health visitor. And people would probably put the full stop there. Yeah. Whereas I think more people now are either whether they've been historically seeing like a physiotherapist, an osteopath, or a midwife that's extended their practice a little bit beyond the parameters of in that sort of antenatal space or delivery space, or GPs that have gone and searched out some more information, so they're specialising a bit more. And even, we train fitness instructors, personal trainers, for example. We have a program for those because we really understand that it's the multidisciplinary approach. So I think now we're seeing that it's becoming a bit more of a shared space where people are thinking about who could I talk to about this? Where could I have this conversation safely? Who's going to help me? Who's going to empower me? Who's going to help this rebuilding movement for myself and my family? So,
you've definitely touched on what and who Mummy MOT is and why it's important for new mums. I also love that you've highlighted it's not necessarily just for new mums. It is just anyone who's on, I guess, their motherhood journey physically, right?
And if I can just add there, because I think it's really important. And we know, obviously, our branding is the Mummy MOT. And it's always one of those things. We do get contacted by women who, have gone through a pregnancy journey. They've effectively carried a child, but, through whatever circumstances around those individual cases have sadly lost the child or had to, they've given birth to a child later or they've had a stillbirth and those situations. But actually, if your body has gone through the hormonal change, the physical change of your body and anatomically changing, then regardless of whether you have that living child, and you're lucky enough to have that living child here, we want to embrace and encompass all women. Okay. And effectively you've had a mum's body. Like you've had that mama body and changes to yourself. So it's also about those women as well. Okay.
I see.
It's all encompassing.
Yeah. I guess many women don't realise pelvic health support is even available. What are the biggest misconceptions around postnatal recovery that you've come across so far?
Yeah.
I know you've touched on a few already, but...
Yeah, so I think it is that element that because mum life is busy, you become a mama, you are, your own diaries get halted and get harder to fit into. So your identity changes. So even for those that are about health and fitness beforehand, suddenly even those women that would make, you know, more time than most women in their diaries for health, it can still get squashed. So I think it's that element that people neglect themselves, so it becomes, it's not about me right now, it's about them. Or that it will heal, it will absolutely fully heal itself in time, because my body has gone through a pregnancy. You already start to see some body changes happening and improving. So you may think that everything at some point will. And at some point can be so open-ended that when your life and your schedule and weeks roll by, months roll by, years roll by, sometimes you can forget that you're still harbouring a symptom that could well have been resolved by now. And I think also with pelvic health, you know, it's a little bit of a, you know, it's a bit more modern day term, isn't it? Because you're so used to going.
I guess. Yeah, something my mom would never have described it like that to me at all, or anything like that. So it does feel like we now have the language and the dialogue to express certain things. Like, she just wouldn't have. So I can agree with that. It sounds very modern. It's true.
You might see a physio generally, but they might not particularly be asking specific questions about. It's seen as quite obviously an intimate area. So therefore, people might think that there's, you know, it's more of a gynecologist that I might need to see, rather than thinking, and they think that there's that whole potential, even if they are thinking about seeking help, they think that they've got to go through the GP, and with the climate of healthcare now being so pressured, that they think there's going to be a number of referrals or waiting time to get through, and don't necessarily aware that there's other support that they can seek to go to. And also, it's not, you know, let's not over medicalize this either, because for some aspects it is, the Mummy MOT is essentially a screening process postnatally. So you don't have to have a blindingly obvious issue as well. You could be seemingly getting on with functional life, but subtle changes, or even just that your core doesn't feel as strong as it did, or when you're walking, suddenly you get a bit of pelvic ache, or you know, you're not quite back to lifting the weights that you were lifting beforehand. It can be quite subtle differences or that take place, and I think it is for everybody and for all. So it doesn't, sometimes it can be just a quick one-off appointment just to have a bit of a health check, reassure and give some advice. Other people, sure, they may need to come in and have some ongoing treatment as you would with another therapist for a shoulder pain or a back pain, or you've bust your knee or something. But equally, some aspects can be self-managed with just the right guidance and empowerment, reassurance. So it doesn't need to necessarily always have that, you know, because cost is always an implication for some people. So, you know, it's about sometimes, if that is the case, come and get the right consultation, get the right assessment, get the right advice and guidance. And then you can be set on your journey, at least that you know what is going on and what isn't going on and what's cool and happy. So
no, that makes sense. I guess looking at community impact of all of this, with the Mummy MOT, I can imagine you've led initiatives that support practitioners, especially in like the training courses, and ensuring that there's a high standard with what you deliver. What does that look like on a day-to-day with what you do?
Okay. So, I mean, I touched on Maria earlier. Obviously, she started this. I mean, we're creeping closer towards a decade now. So, so in reality, like she's trained, and the Mummy MOT as a provider has trained nearly around 900 practitioners, and that's across physios, osteopaths, midwives, and a few GPs.
Okay.
So I suppose in terms of that, there's formalised training that's been put together that's looking at the key elements of assessment that we would look at. And then it's, rather than just stopping the door there, because obviously anybody can train people and share a skill, share a framework, if you like. But it's about being a community, because this kind of stuff requires more cultural mindset movement. So that we change the expectations, so that women are looking for this, they're advocating for themselves, and practitioners can have those conversations and broaden out their conversation. So with that, we have a community of practitioners. So we kind of invite them in after the training, and then we have ongoing training. So monthly training sessions, monthly sort of journal clubs, so evidence-based practice. So we're keeping up with safe practices. We're inviting specialists in their areas to new initiatives, or slightly holistic and collaborative areas that you wouldn't necessarily typically look at in a medicalised world. We're looking at products that can be supportive of differing aspects that we're trying to address, and bringing those all together. And then, we have things like shared WhatsApp groups, so our practitioners can communicate with one another, seek that support, because everyone will get a different mileage through their door of different type of patients that they're seeing. They'll have different personal stories that have resonated or tested their training, their learning.
Okay.
And so bringing that together, it gives that opportunity for people to check in and have that peer support, so that we can best support the women that seek the Mummy MOT out.
Yeah.
And it's really about raising that profile and visibility really to women that, when you're entering even into your fertility journey or pregnancy journey, that you're not alone.
Yeah.
And you don't need to, you can plan your care to support your body the best and optimize it.
Okay.
And I think, as a community, we want to become collaborative.
Awesome.
Rather than just being a transactional training provider, really.
Okay.
And then obviously, Maria Elliott has her sort of main clinic in Marylebone in London. So we're keeping up with practice in terms of us in clinic there, seeing mums coming through, mums of different ethnic, cultural, religious backgrounds, which is really important for us to make sure that that's all considered, because different aspects that we might offer as part of a Mummy MOT, one of the aspects is obviously an internal assessment. But we know that certain cultures or beliefs, they're not aligned to that.
Yeah.
So we need to make sure that sensitively and respectfully that we're still optimising that assessment the best we can for what that mum's body is going to be doing and needing to do.
No, I hear you. Okay. No, I love that you, my next question to you was going to be why it's so crucial to build a strong practitioner network in this field, and you've just highlighted that so well. And I think it's also great just for the listener or for the next person who's looking for a service like this. I think it's so important to understand how connected you guys all are, if that makes sense, and the kind of support that you have. So the learning and the training and the sharing is forever ongoing. I think that definitely kind of offers a type of comfort to know that this space is building and it's evolving as much as it can do to ensure that it gives you the best that it needs to give you. So that's pretty great to hear.
And we've always got room to grow. So behind the doors, there's always so much going on just to try and keep that connected. But I think it's, for the mums, it's definitely, for them knowing that they can be seen, can be heard, can be advocate themselves. And, for any healthcare professionals that are watching this, it's really thinking about listen to hear, and then listen and observe to understand. And then personalization, really. So personalizing to that individual.
Okay. You've mentioned a lot, I guess, about elevating visibility and making sure the services are known to people. What do you think needs to change so more women know about the services like Mummy MOT, or more people know about that?
Yeah, well, we need
big question.
We need to be out there all the time. And it's changing platforms, isn't it? Because, everything is so much, social media is one thing where we need to make sure things are at, you've got all our areas of trying to raise profile and be visible and get on the back of campaigns that are going on around, we've got sort of diastasis recti month, which is obviously the gapping that you can get in your tummy when the baby grows, and you create a gap in your connective tissue in your tummy. And so we kind of get onto those campaigns so we can advocate the messaging again. But really, again, it comes back to that collaboration, because we need the points of contact around talking about a Mummy MOT to be not just on a screen, on a magazine, on a billboard. We need it to be in living rooms, in coffee shops, in antenatal groups, in GP surgeries. It's the thinking about the touch points. So it becomes embedded in the conversation when a woman is talking with their GP or another healthcare professional about fertility, pregnancy, or they've had a baby, that it's prompting those conversations. When a woman is on a pregnancy, an antenatal ward or a postnatal ward, these conversations are picked up as part of your screening, your natural history taking, and again, really that changing that dialogue when a midwife comes out to home and when you're going to see your GP. I think if we started to see the conversations happen in those places, and even if that's not dressed up as the ideal, the creme de la creme would be that it is the Mummy MOT that's obviously utilised, because it could be coined as other ways of saying the Mummy MOT. But for us, our Mummy MOT is very comprehensive. It's not just asking questions. It's not tick boxing. It's we're really genuinely looking not just even at we look at posture, your pelvic floor muscles, your breathing patterns, your functional movements, your scars. It's all of those aspects that are come together. It's not just a quick 10-minute screener that's going to give all the answers and give the advice. So I think changing the arenas we're talking about it would be the biggest thing, because then we'd know that women understand that they do matter, their bodies matter, and they can rebuild and heal it and restore in much stronger ways than we're kind of led to believe right now.
Okay. What role do you think digital media or social platforms play in empowering women in this kind of knowledge? I know you touched on it ever so slightly, but yeah.
And there's always that side, with any topic that we're discussing, every topic in the world is on social media, right?
I know, right? Yeah, exactly.
And you've got the lovers, you've got the agreeers, you've got the haters.
Yes.
So everyone's got something to say. And I think that's something probably as pelvic health physiotherapists in this kind of space, pregnancy and postnatal at the moment, we sit back and we observe a lot of traffic on social media. And I think it's just looking at it with caution and credibility is my advice to kind of mums looking at things. Look at who's giving the advice out, what's their background. We see a lot of sort of beauty settings now talking about pelvic health, and that they've got technology in that claims to support your pelvic health and things like that. But so for me, it's just that guidance and advice around it being used cautiously and thinking about who's the professional, what background have they got that's giving and advocating that advice, what sort of training and qualifications sit behind it, because and don't get me wrong, lived experience stands for a lot, but if we're going to put ourselves in a digital platform where we're really talking about and advocating, we need to make sure it's credibly and safe sharing.
Of course. No, I hear that.
So,
No. I mean, as you've mentioned, you're a mum yourself. How is, it's almost like, how does real life, it's all real life, but how does real life sort of impact or sit alongside everything that you're doing that's clinical? How is that feeding into your everyday life as a mum and your body, your pelvic health, everything?
Absolutely, because you get given this little baby when they come out, aren't they? And they're a certain weight, some weightier than others, but they grow, and their needs grow. They're how dynamic they are. The things they want you to do. You get on the trampoline, climb up the craziest of smallest spaces, to go up a fort in a park, and then fireman pole down it or jump down it. There's or just you watch any mum go shopping and try and carry a car seat and 3-4 bags of shopping. So for me, I think it's been watching and observing and feeling my body through all of those aspects, right from, my children being very tiny and just the impact even on, elbow pain or, feeling that I need to pee more and things like that, through to what I'm cautious of. So, yes, I'm happy to, go on the trampoline, but have I got a trampoline curfew that's being set in my pelvic floor? So 100% that. It's and I think that's where I talked about being attuned to partnering up any advice that I'm giving or that we're teaching on our training, that we're in tune with what a mum's body has to go through physically, just in a day-to-day demand of what a child's desires are and keeping up with their early freshness and speediness. So I think it always, you're giving advice out, you're giving education, or you're doing hands-on therapy or exercises, and you're always mindful of, if you're having it done to yourself, what impact is that giving me? What outcomes am I getting? What's not quite working? Actually, how can we problem solve that, or understand why that might not work for some people? So it keeps the knowledge fresh. It keeps us, it stops us, it prevents us from being static. And it's always, making, and just watching friends, actually, seeing the things they do. I've got friends that have never weightlifted in their life, and suddenly, they're aware of perimenopausals kicking around, and they want to suddenly do more. They want to do weight training. They want to do stuff, and it's kind of being on their journey as much as my journey, actually, and seeing how progressive we can be.
Yeah. Okay. What excites you most about the next phase of Mummy MOT?
So I think it's always the opportunity to connect. Okay. I think, if you ever met Maria is the biggest connector going. You can aim to have a 5-minute conversation with her and 2 hours later you can still be talking. So I think for us it's about rather than wanting to sideline and just try and do something yourself and be very protective of what you've grown. It's actually now about how we utilise the expertise of other people and work together. Because as I spoke about before, when you're looking at something so widespread, I mean, we're fortunate enough that we've got practitioners nationwide and even international. But actually to really truly connect and make those changes for every woman that's coming out of a midwife appointment, a doctor's appointment, antenatal class or a maternity ward. Yeah. We need to connect, we need to talk, we need to, so we've got big changes going on at the moment with our training program, which we're really excited about. And then we've got, as I say, it's who we're connecting with in the space around pregnancy and postnatal sort of products. It's the locations that we're linking with about getting involved with charities and talking about birth injuries, birth traumas on one side, but also really looking at where people are just thriving. And also for us, it's about the language is so powerful. And we talked on that earlier when you were sharing about, torn to shreds.
Ripped to pieces. That's another one.
It's just, for us, it's just, that I think it's exciting to think that all of us on this movement, we could be changing just how people feel about reducing that anxiety when someone's looking at getting pregnant and having a baby. Okay.
For any women listening who are struggling with their recovery or feeling dismissed, what would you want them to hear right now?
Yeah. Don't shy away. You think, be proud of what your body's gone through first and foremost. Be proud of the journey that whatever has led to you carrying a child or having that child there and being a mum. Your body's gone through a lot. So just recognize that. Recognize actually that change doesn't, what other life transition would we treat with the same dismissive to self behaviors? Yeah, okay. We go through a change of job. We go through, even for some people, change of car. We go through a change of house. People might go through a breakup or a divorce. We give ourselves time to heal. We recognize the pain. We think about what our next steps are, and we look at some form of leveling up and changing and planning our next steps and having some goal and ambition to change from where we sit now. So I'd want you to know that is absolutely possible with your postnatal body. You may carry symptoms. You may emotionally have had to change or be changed by those things. Your relationship, your employment, your hobbies, your friendships, all those things that, can absolutely, obviously, positively be impacted and embraced and changed and elevated. But if it's not, then, look out, speak up. Let's change the taboo of the topic by speaking up. Be that it's a safe space of a close friend that you confide in, be that you've got a healthcare professional right now. But at the very least, just go to the Mummy MOT website. Whether you go through and click into an appointment is absolutely your call. I'm not here to do any sales pitch by any stretch. It's about raising awareness that you can seek help. Be that it's with your own doctor or a local practitioner who offers some form of care. But from the Mummy MOT perspective, look, there's some advice, resources. You can go on a directory listing, you can type in your postcode, it will pop up who's closest to you. And even if it's just a discovery call that you want to make with them to see whether it's a fit and whether you want to book in, even if it's just to have an appointment or a telephone call to seek some advice, but don't stay stuck. Advocate yourself, because advocating yourself will be the biggest thing that you can do for your children, because your body will be what is carrying them, engaging with them, getting involved with them. And also it's what they see, they see a mama. They see a mama healing and seeking help and advocating their needs. And that's really inspiring and empowering. And that changes the course of the next generation that come through. That's true. Yeah, I agree with that for sure. What's one piece of advice you'd give to all new mums that you wish was more widely spread? look after your pelvic floor during your pregnancy.
Okay.
So I think that's the thing, because look early. So just, it can be very simple. We can prepare.
Yeah.
So prepare is better than being reactive in any stretch of most things in life to a point. But unless you're really spontaneous. But I think it's just, prepare early. Like, we look for, we read up, don't you? You get the apps. We all go on the apps.
Yeah, totally.
How big's the baby?
100%. What size fruit are they?
It's
and all the
raisin.
things.
It's a peanut.
All the things, yeah.
Oh, it's an avocado. We do that. We learn and we look up what's happening, what system's developing now. Even though we're not seeing that system and we're not interacting with that system, we're still really interested. We're invested because this is this life inside of us. But the body that's carrying and is the vessel essentially for that baby, we automatically maybe go to things like nutrition, or our vitamins.
I'm thinking about all the things I did. Yep, that was me. Yep.
Yeah, we might think of those things, or we might try and be a bit more rested, or try and avoid stress.
Yeah.
Some things. So why not throw in some pelvic floor stuff there? Why not? Even if you simply just put in to Google pelvic floor exercises to strengthen, and you just pop that in, or reached out for some guidance in terms of how to support even just some natural breathing to connect with your pelvic floor better. Yeah. I just, if it was literally down to one piece of advice and I can only say one line, I think that would be it. Just prepare you as well as you can, and enable that focus to be on you and your body. Yeah.
Okay. And lastly, what's the one thing that you do to support your own well-being while leading such an impactful life?
Yeah. So I think it's, again, coming down to where can I put my own sort of pelvic floor exercises in. And I recognise myself that when you are busy and you're bustling around, it's very easy, like, for me to hold my breath or feel tense or carry lots of tension, and you can disconnect that in a way from your pelvic health, like if you're not aware of the connection. So you kind of just running around and you might feel, oh, my neck's sore, or my shoulders sore, my back's sore. And for me, I think it was, even though recognizing my own healing journey and that I'd healed and rebuilt the strength and the coordination of the pelvic floor, what could actually break that down again? What's stopping me being as good as I can be? And it came as simply as breathing. Okay. So actually for me, my biggest thing that I do for myself is try and take that breath and find where I can exhale and let go and really just connect. So for me, it's going and doing something as simple as a little bit of yoga, but being really mindful of just engaging. Once you've got the awareness of your pelvic floor and you're taught about it, you then recognise how you can just very simply, actually, just day to day, do little snacks of engaging with it. Really. Okay. And just speaking up empowers so much, because you can. It's easy to think, oh, it's just me, or someone's going to think that I'm making a bigger deal of this than it is, or no one will be able to help. And actually, if you put and as we have had in rooms bunches of women together, the colourful stories that come to life, but actually not just the richness in what people have been through, the richness in their journeys to heal and recover is so empowering to cross-fertilise and share ideas and what's worked and what's not, or just empower another woman to go and say, it's all right, go get help. Like, this is cool. There's a path forward for you.
Yeah, that permission to act. Yeah, I think that's so impactful. But yeah, Kirstie, thank you so much for your time. I feel like this is literally just scratching the surface and all the things surrounding the Mummy MOT, pelvic health, and the things that we can do to take care of ourselves. But I just know even this has definitely been so incredibly valuable to anyone who's listening, so they know what to do, where to go, what to look out for. And I look forward to, I feel like I'm trying to figure out how to get you back again to just talk more, but I'll figure that out and let you know. And you'll be here. But
it'd be lovely to talk to the other mums.
There we go.
Exactly. Like we do a panel podcast.
There we go. That's all that is in motion, trust me. But yeah, no, this has been super, super valuable. So thank you.
Thank you so much, and for everybody listening as well.
Guys, thank you so much for joining us today. I hope you're leaving this episode feeling a little more seen, a little more informed and supported on your motherhood journey. If you're a practitioner that wants to enhance your training and support women on their pregnancy and postnatal journey, please head to the website and reach out to Kirstie and the team on help@mummymot.com. As always, thanks for listening and keep going, Mama. You're doing great.